All right, we'll continue with Chapter 15, the Musculoskeletal System, Part 2. Now, let's look at the combining forms, so what true medical terminology is about. All the first half was just introduction to anatomy, but calcium, calcium, so if somebody has hypercalcemia, they would have excessive calcium in the bloodstream. Again, calci would be another calcium, so decalcification would be removal of calcium from bones. Kypho is a posterior curvature of the thoracic spine, so somebody would have kyphosis. Lamina is, so that's a part of your vertebral body, so if somebody is having a laminectomy, they would have a removal of a lamina to relieve the symptoms of a ruptured IB disc. What about lord? It's curve. It means lordosis. Abnormal anterior curvature of the backbones in the lumbar region. So your butt would stick out if you have a extreme lordosis. Okay, so lumbar, loins meaning low back. So lumbar region would be pertaining to the low back. Myelo means bone marrow. So myelopoiesis is formation of bone marrow. Ortho is straight, so orthopedic, pertaining to orthopedics. Okay. Osteo is bone, so osteogenesis would be the formation of bone. Scolio is crooked, so scoliosis is the abnormal condition of lateral curvature of the spine. Spondylo is vertebrae, so spondylolysis or spondylolisthesis. Spondylitis would be inflammation of the vertebrae. Spondylolysis is an abnormal condition of the vertebrae, which is basically wear and tear. And the vertebra or vertebral would be pertaining to the vertebra. Blast, embryonic cell. So osteoblast is an immature bone cell. Clast means to break, so osteoclast is a large cell that will break down bone. Listhesis is slipping, so again spondylolisthesis is a forward displacement of vertebrae, so it could be L4, L5 spondylolisthesis. Malaysia is softening, so chondromalacia or osteomalacia, softening of bone. Physis means to grow, so epiphysis is the ends of the long bones. Porous is a pore passage, so someone that has osteoporosis, a condition of increased pores of the bone. Tome is an instrument to cut, so osteotome is an instrument to cut bone. Terminology related to specific bones, we have acetabulum, so acetabulum, hip socket. Calcanea, calcaneus is the heel. Carpal would be carpals, wrist bones. Clavic would be clavicle. Collarbone. Cost means ribs, and cranium meaning cranium, skull. Femur, so femoral. Femur, thigh bones. Fibula, smaller lower leg bones. Ilia, meaning the ilium, upper part of the pelvic bone. Ischia, meaning ischium, part of the pelvic bone. Maleo, malleolus. Mandibulo is mandible, lower jawbone. Maxilla is maxilla. Metacarpals, hand bones. Metatarsal, foot bones. Olecranon is the elbow. Patella is the kneecap. Pelvic is the pelvis. Right? So if you go back to some of these suffixes, right? So blast, we talked about that. But if you look at these as combining forms, right? So we could go acetabular, calcaneal, carpal, femoral, fibular, humeral. Peroneal or peroneus means the fibula. Phalanges, finger. Pubis, radius, and the scapula. Sternum is the breastbone. Tarsals, tibia is the shin bone. Ulna is a lower arm bone on the inside. Okay. Let's look at some pathology related to the musculoskeletal system. You might see it as the MSK system as well. But a Ewing sarcoma is a malignant bone tumor. Exocytosis means bony growth on the surface of a bone. Osteogenic sarcomas are malignant tumors arising from bone. Osteomalacia means softening of the bone. Osteomyelitis is inflammation secondary to infection. Talipes are congenital abnormality of hind foot involving the talus. So babies are born with a club foot. Fractures, you have simple fractures which are closed, meaning they don't break the skin. A compound fracture would be open, so it breaks the skin. Colles fracture, very common in the wrist. And then you have compression fractures in osteoporotic patients. Commuted fractures basically is just broken in half. And kids will get what we call a green stick fracture, meaning if you've ever broken a stick and the two ends still stay connected via this strand of bone. Now, joint is articulation coming together of two or more bones. Suture joints are immovable parts of the skull. Synovial joints are freely movable, such as the ball and socket, which is in your hip and shoulder. And then you have a hinge type, such as your elbow, knee, and ankle. Synovial joints are a joint capsule that surrounds the bone. Ligament bands the bones together. Bones are covered by articular cartilage. Remember, that's just like tread on a tire. You don't want to take too much off, but once it's gone, that's it. Synovial membrane lies under capsule and lies synovial cavity. It's filled with synovial fluid that helps lubricate the joint. Meniscus is a crescent-shaped fibrocartilaginous structure that partly divides a joint cavity, acts as a protective cushion present in the knee. Now, once you tear your meniscus, unfortunately, there's no repair as well. Bursae, closed sacs of synovial fluid with a synovial membrane located near but not within the joint, needed where sliding must take place. Common sites between tendons, connective tissue connecting muscle to bone, between ligaments binding bone to bone, and then between skin bones. Okay, so bursa are non-contractile. So if somebody has bursitis, they're going to have pain at rest, whereas somebody, if they have tendinitis, they're going to have pain with contraction. So here's a joint here. There's a femur, patella, bursa. That's what a bursa looks like. Again, you don't have to label any of these on a diagram. This is just to help you learn a little bit better. There's the femur. There's your ACL, PCL. Here's the meniscus that people talk about. What is that? There's your medial meniscus. There's your lateral meniscus. And then here's your MCL. Some people usually tear their ACL, meniscus, and MCL all at the same time. Okay, you have articular cartilage, articulation, bursas, and ligaments. So articular cartilage is smooth, glistening white tissue that covers the surface of a joint. Articulation is any type of joint. Bursa is a sac of fluid near a joint. Ligament, again, attaches bone to bone. You have the meniscus, suture joint, synovial joint. A meniscus is crescent-shaped fibrocartilaginous structure found in the knee. Suture joint, immovable joint, synovial cavity, space between bones at a synovial joint. You have synovial fluid, synovial joint, synovial membrane, and the tendon. Synovial fluid, viscous fluid within the synovial cavity. Synovial joint, freely movable joint. Synovial membrane, tissue lining the synovial cavity, produces synovial fluid. And then you have tendon, which is a fibrous connective bands that connect muscles to bones. Quick quiz. The fibrous connective band that binds muscles to bones is a tendon. Remember, muscle to bone is tendon. Bone to bone is a ligament. So ankylosis is stiff. Okay, so if you have ankylosing spondylitis or ankylosing spondylosis, there's a lot of terminology that you can see in the medical charts. Arthro is joint, so if you have arthritis, that would be inflammation of the joint. And there's different kinds of arthritis. You have osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is congenital, whereas osteoarthritis is just wear and tear, which a lot of you will get as you get older. Okay. Not that I want. I'm just saying that that's something that you can get. So again, ankylosis is an abnormal stiffening and immobility of a joint. Arthro is arthritis, or you can have an arthroplasty, which is surgical repair of a joint. Articulo is a joint, so articular cartilage is cartilage found in the joint. Bursa, remember bursitis is inflammation of the bursa. Chondro, let's say you have achondroplasia, which means improper cartilage formation. What about ligament? So what about ligamentous? Means pertaining to a ligament. Rheuma is watery flow, so rheumatologist is a specialist in treatment of joints disorders. Synovial fluid. So what if you have synovitis? That would be inflammation of the synovial membrane. You have tendon, you have tendinitis. That could be inflammation of the tendon. Okay. Desis is to bind together, so arthrodesis would be binding together or a cervical fusion of a joint, and stenosis is narrowing, so you could have lumbar stenosis or cervical stenosis. Now arthritis, a couple kinds of arthritis. Again, there's inflammation of any joint, but ankylosing spondylitis is chronic progressive stiffening of the joints, mostly the spine. You have gouty arthritis, which is inflammation due to excessive uric acid. You have osteoarthritis, which is loss of articular cartilage and formation of bone spurs at articular surfaces. Can occur in any joint, but mainly in spine, hips, and knees of older people. Then you have rheumatoid arthritis, RA, which is an autoimmune reaction against joint diseases. There's rheumatoid arthritis. Again, rheumatoid arthritis is systemic, so it occurs in both knees, both hips, both ankles, whereas osteoarthritis will occur in just your right knee or your left knee or whatever the case may be. Okay. Now the bunion, women get mostly bunions because they've had too tight shoes or the way high heels. So bunion is a swelling of the medial aspect of joint between the big toe and first metatarsal. You've heard of carpal tunnel syndrome, which is compression of median nerve as it passes between the transverse ligament and bones. And then dislocations or displacements of bones from a joint. Here's what carpal tunnel, people can say that they had numbness and tingling in there. Ganglion is a fluid-filled cyst arising from the joint capsule. They used to hit like a little ganglion cyst with the Bible because they thought that that would go away. It was work of the witches, and even though they would hit it with the Bible, it would come back. So they said only witches could bring it back. Herniation of an intervertebral disc is an abnormal protrusion of the disc into the neural canal or against spinal nerves. That's a slip disc. What about Lyme disease? That's recurrent arthritis, myalgia, malaise, and neurologic and cardiac symptoms often marked by a bullseye rash at the site of the tick bite. So it's usually caused by ticks. What about a sprain? Again, trauma to joint with pain, swelling, and injury to ligaments without rupture. Systemic lupus, chronic inflammation involving joints, kidneys, skin, nervous system, heart, and lungs, affecting collagen, tendons, ligaments, bones, and cartilage all over the body. And they usually have a telltale butterfly rash around their cheeks. All right, so we made it to the muscles. There's three types of muscles. There's striated, smooth, and cardiac. Striated is under voluntary control. That would be like your biceps. They move all the bones as well as the face and the eyes. Smooth control is involuntary. You can't tell your digestive system, your stomach to digest, your blood vessels to contract. And cardiac, again, is not voluntary. You don't have to tell your heart to beat. That's automatic control. Again, you don't need to know the different types of muscle from diagram, and you definitely don't need to memorize any of the muscles. That would be an anatomy class, but just realize that they're named for a reason. Like, let's say temporalis is near the temporal bone. Occipital frontalis goes from your occiput all the way to your frontal bone. Orbicularis oculi is around the eye. Okay, so a lot of times they're named for a reason. Think about that sternocleidomastoid. It goes from your sternum to the clavicle to your mastoid process. What are the actions? Flexion, extension, abduction, adduction, rotation, dorsiflexion, plantar flexion, supination, pronation. If you look at that, that would be these: flexion, extension, dorsiflexion, plantar flexion, pronation, supination, abduction, adduction, and rotation. All right, the home stretch now, vocabulary muscles. So you have abduction, adduction, dorsiflexion, extension. These are ways that you would move. So abduction, abduction is movement away from the midline. Adduction is movement toward the midline. Dorsiflexion is upper movement of the foot, but extension would be straightening of a flexed limb. What about fascia? Flexion, insertion of muscle, origin of muscle. Fascia is a fibrous and embedding muscle. So remember how ligaments attach bone to bone, tendons attach muscle to bone, but fascias kind of do muscle to muscle, basically. Flexion, downward movement of the foot. That would be more plantar flexion, because you can have flexion of your shoulder, flexion of your elbow. So flexion in itself means decrease in the joint angle, but plantar flexion would be downward movement of the foot. Insertion of a muscle, connection of the muscle to a bone. Origin, connection of the muscle to a stationary bone. Then you have plantar flexion, pronation, rotation, skeletal muscle. Plantar flexion, again, is bending the sole of the foot downward toward the ground. Pronation, turning the palm downward. Rotation, circular movement around a central point. Skeletal muscle, muscle connected to bones, voluntary or striated muscles. Smooth muscle, striated muscle, supination, visceral muscle. Smooth muscle is visceral muscle, striated muscle is skeletal muscle. Supination is turning the palm upward, like sup man. And visceral muscle is muscle connected to internal organs. All right, what's movement away from the body? That would be abduction, B as in boy. All right, so let's look at the tail end of the medical terms, which are probably more important. So what about fascia? Fascia, what about fasciectomy, removal of the fascia, or a fasciotomy would be incision into the fascia. Okay. Fibrous, fibromyalgia, you've heard of that. That's pain of fibrous connective tissue and muscle in various parts of the body. How about the leiomyo, is smooth muscle. That's leiomyoma, would be a tumor of smooth muscle, and myo is muscle, so myalgia would be pain in the muscle. Myocardia is the myocardium, pertaining to the heart muscle. Myo muscle would be, so myositis would be inflammation of the muscle. Plantar, pertaining to the sole of the foot. Rhabdomy, skeletal muscle connected to bone, so rhabdomy. How about a rhabdomyoma? That's a tumor of the skeletal muscle. Rhabdomyosarcoma is another malignant tumor of the skeletal muscle. Okay, so myoma would be benign, but a myosarcoma would be malignant. Okay. Asthenia, lack of strength. So myasthenia gravis, condition of muscle weakness caused by failure in transmission of nerve impulses. Atrophy, development, so atrophy would be decrease in size. So you've got your prefixes, you've got your ab away from, ad toward, dorsi back, poly many. Okay, so again, pain in the muscle. So what if you have polymyalgia? Dorsiflexion would be bending of the foot backward. Adduction is toward, and abduction is away. What are some pathological conditions of muscles? You have muscular dystrophy, a group of inherited diseases with progressive muscle weakness and degeneration without nervous system. Polymyositis, chronic inflammatory myopathy, may be an autoimmune disorder. And then you have all these lab tests that you can do. ANA, which is an anti-nuclear antibody test. ESR, that's to test for rheumatoid arthritis. A rheumatoid factor test, RF. Serum calcium, serum creatine kinase, and a uric acid test. Clinical procedures related. Again, I'm not going to ask you what any of these tests do. You just need to know what ANA may stand for, or what it stands for, and how to spell it correctly. Clinical procedures related to bones. You can have arthrocentesis, arthrography, arthroplasty, arthroscopy, bone density, bone scan. You can have a computed tomography, discography, EMG, MRI, and a muscle biopsy. So what are the abbreviations? AC, ACL, ANA, BKA, BMD, C1 to C7, CA, CK, CMC. So AC would be the acromial joint, ACL is your anterior cruciate ligament, ANA is your anti-nuclear body, BK is below the knee amputation, BMD is your bone mineral density, C1 to C7 are your cervical vertebrae, CA is calcium, CK is creatine kinase, CMC is your thumb, which is your carpal metacarpal joint, CTS is carpal tunnel syndrome, DEXA is dual energy X-ray absorptiometry, DMARD is a disease-modifying anti-rheumatic drug. DO, DTRs, EMG, ECR, HMP, IM, L1, L5, NSAID, OA, or F. So DO is a doctor of osteopathy. DTRs are deep tendon reflexes. EMG is electromyography. HMP, herniated nucleus pulposa. IM, intramuscular. L1, L5, lumbar vertebrae. NSAIDs are non-steroid anti-inflammatory drugs. OA is osteoarthritis. ORF is an open reduction that they could do with a fracture. Ortho is orthopedics. OTP, PT, RA, ROM, ROM, SLE. So OT is occupational therapy, P is phosphorus, PT is physical therapy, RF is rheumatoid factor, ROM is range of motion, SLE is systemic lupus, T1 to T12 is the thoracic vertebrae, and a total knee replacement is a TKR, total hip replacement is a THR, and your TMJ joint would be the temporomandibular joint.